Hi, good morning, everyone. Thanks for connecting us. We will be going to start this webinar in another 5 minutes. So we are waiting for some more participants to join. So here on a board along with us, Ms. Seema is there. She is our trainer. Ms. Seema, can you just please switch on your camera? We are waiting for some more participants to join. Just give us 4 to 5 more minutes. So we will be going to start this webinar by sharp 11 o'clock. So I request you guys, whoever has shared our link in your friend circle, you can just tell them to come and join us as soon as possible.
Hi, good morning, everyone. Just waiting for a few more participants to join. Walaikum Assalam.
Can you hear me, Ms. Seema?
Yeah, I can hear you.
But I can't hear your voice.
Just a moment. Hello? Am I audible now?
Hello?
Hello?
Can you just check? I can't hear your voice, Ms. Seema.
Just a second. Hello?
Hello.
Is my voice audible now?
Ms. Seema, can you hear me?
Is my voice audible now? Hello?
Hello?
Is my
Can you
voice
say something,
audible?
Ms. Seema? I can't hear your voice.
Hello? Hello? No? Just a second.
Yeah, we can hear you, Seema.
Hi, good afternoon. We can hear you clearly.
Hi everyone. Can you hear me?
Yes, we can hear you.
Thank you.
Hi, Miss Seema. Can you hear us?
Yes, I can hear you. Hope my voice is audible now.
Seema, can you hear us?
Yeah, I can hear you.
You can hear me, right?
Yeah.
Yes, she is audible. Okay. अपने से Miss Seema, can you just switch on your camera, please?
Yeah.
So I guess everyone can hear Miss Seema, right? If everyone can hear, can you just send me a thumbs up on the chat box? Perfect, Mr. Said. Yes, okay. Thanks, Miss Raila. Thanks, Miss Aisha, Amira, Amir. So can we start this session? Just give us 5 more minutes. So some more participant is joining us. In case if you find any difficulties, guys, there is an option called chat box. You can just send them. You can just send a message over here. So we are ready to rectify it.
Mic turning, ma'am.
So now we are going to start the session. So I would like to introduce our trainer, Ms. Seema. She is the food safety approved trainer from the Dubai Municipality. And today the session is all about going to be related to the HACCP awareness session. So I request Ms. Seema to introduce herself and start this session. Thank you.
Hi everyone, this is Shima. So I'll be giving you a training on HACCP today. So I'm the trainer on food safety management system from TMC management system. So today we'll be getting an introduction awareness on HACCP, which is a hazard, which means the hazard analysis and critical control points. So I'd first like to get introduction from you guys as well. So can you just one by one unmute yourself and get your introductions, please?
Morning
Hi,
to
Ms. Shema.
Hi.
This is Muhammad Waqas. I'm working as a HSE engineer, and I have in construction MEP field like 9 years experience.
That's good. Thank you.
Hi, Shima.
Hi.
This is Vaishnavi here. I'm working as a quality controller in a water industry.
Good. Nice.
Good morning, Shima. This is Parasuraman, working as a quality control manager for a food industry. Thank you.
Thank you.
Good morning, Ms. Shima. This is Khurram Riaz, working as a KHDA executive with Facilities Management Company.
Thank you.
Hello, Sima. It's me, Pema Sherpa. I'm a student of agribusiness. Yeah, I'm a student.
Nice. Thank you.
Hi, everyone. I'm Alvin. I'm working as a workshop technician in the Department of Oil and Gas, but I've got experience in food industry, specifically Coca-Cola manufacturing. And I've got 12 years of experience. Thank you.
Thank you.
Hello.
Yes.
Assalamu alaikum everyone. I am Aisha Kabir. I am a QC executive in Britannia company.
Hi, this is Sajid Ali, Business Development Manager for Karachi Grill Restaurant. I have a 25-year experience in Dubai in F&B industry. Thank you.
You're welcome. Thanks for joining.
Hi, good morning, everyone. I'm Amir Khursan, working as a QHSC officer in Ensemble Middle East Catering, LLC, Dubai. Thank you.
Hello, Ms.
Hi, good
Shima.
morning, everyone.
My name is Mohammed Sohail. I am working as a accommodation manager in facility management. I have 13-year experience.
Good. Thanks for joining.
Hello, good morning. This is Mohammed Mustafa. I'm a health and safety officer in a construction company. I have 8 years of experience in construction industry. Thank you.
You're welcome. Thanks for joining.
Hi everyone, this is me, Sanayaz, the owner of Karachi Grill Restaurant.
Hi, thanks for joining.
Thank you.
Hi, my dear. My name is Rayan Farouk, and I'm starting off with my father's business, Karachi Grill.
Nice. Thanks for joining.
Hi, morning everyone. This is Vivek. I work as a HSE officer for a EPC.
Thank you for joining, Vivek.
Thank you.
Hi, good morning. This is dietitian trainer. I'm working in Zivanza Millennium Medical Center. I have 5 years experience in the clinical dietitian field.
That's great. Thank you for joining.
Thank you.
Can we start now?
Yes, you can please proceed ahead.
Yes.
So thanks everyone for your introduction. So next we'll be moving ahead with the training on the topic. So I kindly request everyone to mute their phones. And sorry for the Zoom call. So the session today will be HACCP awareness training. So usually food safety, that means assurance that food is safe. So here we'll be discussing on the topic how HACCP has implemented in all the manufacturing sector, how it helps to keep our food safe. So here food assurance will not cause any adverse health effect mainly, so that itself is the meaning, like hazard, it is safeguarding ourselves from the hazards caused due to the adverse effects. And here we are concerned on our consumers as a manufacturing unit. So when it is prepared, it should be according to these standards and it should be safe for our consumers. So food safety hazard here refers to any agent with the potentials which helps in aiding us from helping like adverse effects of the health. And basically when does the hazard occurs, or so we'll be maintaining our manufacturing units or the hazard to control. So food safety hazards may be of 4 different categorized or many more. So basically it was earlier biological, physical, or chemical. Now there are many other added on like allergens or any of the ingredients which is not like in the European countries, peanuts were considered as allergic. So how we are labeling it, and as well as now for the GMO crops, which are biotechnology related. So hazards may be introduced to the food supply anytime during harvesting, formulations, or processing and packaging, or during the transportation, storage, and serving to the people if it is in hotels or restaurants. So this food safety is what we are concerned with and we have to look on. So coming to the basic definition of hazard, so it is the hazard analysis and critical control point. So how it can be managed and done. So food which is free of all the contaminants and will not cause any harm or injury, that's called a safe food. And every FBO has the legal and moral responsibility to implement a food safety management system, or which is also called as FSMS or FSQMS, to minimize the risk of food poisoning. So here FSMS, what is it majorly known for? The food safety management system. So all coming, if you are considering a manufacturing of ice cream industry, so what you'll be majorly looking into it. So there we have a team, how it is, how a setup is formed. So basically what all the things we will be requiring on on the technical part, or as well as the um, technical and how the team works. So here the FSMS is a systematic approach to controlling food safety hazards within an FBO in order to ensure the food is safe to eat. Here the hazard maybe in an ice cream industry, the temperature or how the processing is done, that will be a critical control points where we have to look into. So I just want to know, so based on your, there are people from different industries now. So what you will be considering if you have a hazard system, wherein you have kept your critical points, or which is considered as a critical limits what you have mentioned as per your procedures or the SOPs. So anyone who can tell me what are the like critical points which you have kept in your systems? Anyone who is aware on the systems?
For physical metal contamination, just little metal detector will be considered as this one.
For
For metal contamination, physical metal contamination, metal detector will be considered as a CCP.
Yeah. So if it is a metal detector, so what is your limit you have kept? Like how you are controlling it?
So the controlling limit just we have fixed so that just it will be checked routinely every hour, so that it can be just checked, and we monitored, and we ensure that there is no metal contamination in that. We did a study that HACCP study previously, just in each and every process, just what are all the hazard is there each and every step, physical, chemical, biological, as well as you rightly said allergic. So that just based on that, each and every process step, just what is involved, and accordingly just we made as a plan, so that in our industry just it is metal detector, and there is a possibility from the equipment, just and this one, so that just metal detector has been put as a CCP, so that we are monitoring continuously.
So that is the point of control you have.
Yeah.
So anyone else from other sections who can tell what the critical points you have kept, so that we can relate to the same points?
Hi, Shema. Since actually I'm working as a HSE, but additionally I have some role in my company related to worker welfare. So if we are talking about a food hazards and food safety, what we are doing in our organization for the critical some focus points, what is the food cooking process, what is the packaging process, what is the deliver process, and what time we are going to distribute among the workers. So actually and basically we are controlling and we are looking after the time scenarios, because this is most important, because our food is hired by a third party catering company. So we are closely monitoring what time they are cooking, because we cannot, if this food is cooked earlier and we are bringing this food too long after to distribute at a site, so maybe it can be spoiled. And then after major point, what we are focused about the packaging. We are more focusing and reliable on a recycling process. In recycle, we focus on major two things. First is about the food waste, how we are going to control food waste, and in case there is a food waste, how we are going to manage that. And the second thing, what is the packaging? The package earlier, and mostly we are using this aluminum containers, plastic containers, but
or the SS ones.
yeah, but we are trying to replace all these things on the recyclable, so it can be more friendly and sustainable.
That's good. So how do you monitor like your customer and to keep it safe?
See, we appointed a representative in our accommodation who is completely closely monitoring all this process, like first what time the food cooked into the kitchen, and what is the hospitality and the kitchen staff competency level. In competency level, we are checking their hygiene, their regular these trainings, and their physical appearance, and how they are maintaining the kitchen, like the temperature, cleaning process, cooking process, etc., etc. After that, this representative also monitoring the packaging process. Then after packaging, this gentleman reporting us with the date wise and time wise, while the food step by step is cooked. This time it is packed, this time it is into the hot containers with the food distribution vehicle, and then after finally once it is reached on the site, we are there to monitor that.
Oh, that's good. So you already have a a systematic arrangements on the hazard.
Yeah, yeah, but not deeply, just formally and journally.
Okay, that's good.
Allah aşkına da biz mi yaptık? Hayır.
So anyone else?
Siz şey bahsediyor musunuz? Sürekli yani yaptınız ya.
Hello.
Dear all, if you can please mute all your mics so we can hear our instructor. Thank you.
Can you please mute your mics? So next, moving on, is how we'll be considering if food is not manageable, or how we can tell this is a hazard.
It is, just it cause any adverse health effect, just so that we can say that the food is not safe to consume.
Sorry, come again, sir.
It will cause any adverse health effect.
Yeah.
So that the food can be, just we can tell that, it is not safe for consumption.
Yeah. That only when you have a team or there is a particular hazard person who can identify it, and then you can make it a note that this thing will cause a hazard.
Yeah, because whether as per our study, whether it is within the critical limit or not, just if it
Yeah.
exceed the critical limit, yes, it is causing, because we have already did the study that, if it is going excess of the critical limit, it will cause the problem, health effect.
Yeah, sure. It's the thing how it works. So next, moving on, how these hazards will be affecting onto our daily routines. So it can cause illness, injury, or maybe sometimes death, as per some of the European countries who have got allergic to few of the things, like we Indians or the Asians, we consider peanut as just as the day-to-day which we use in our food. But in Europe countries, we consider sesame or the peanuts is considered as a hazard or allergic to them. Or the customers or the scrutiny of EHOs and the health departments and prosecutions, fines and imprisonment when it is considered as a hazard and which is not implemented by the company or the manufacturing sectors. And due to the hazard, it might also lead to loss of business and the customers also. So few might experience some things that it will cost to their health, so the customers might not return to the companies, and based on that there might be loss of jobs, to the employees working with the manufacturing units, and also the manufacturing sector, the manufacturing company might shut down in the next processes, because if there are no customers, no sales, and all these things will affect into the loss of the company, and finally it may shut down. So these might be the major consequences on your hazards if it is not maintained, or there is no plan in your sectors for hazard maintenance. So coming to what makes the food safe. So how we will be maintaining the food here is safe. Here, that can I know, like after you have kept your hazard plan, and how you will be following it in the future processes. So you have a HACCP team, you have the HACCP plan in your systems, and next how you will be maintaining it. Like I have discussed, there might be 4 or 5 things which majorly we consider as chemical, biological, physical, and the GMOs which might be affecting. So you have a HACCP team, has a plan and all. So how you will keep it as your food as safe? So anyone else who can explain on this, or we can have a discussion?
Yeah, it should be validated on just we have to monitor continuously on time frame, so that it should be the method, or what we have checked is scientifically proven or a validated one, and we have to verify, so that just we have to monitor. Validation and verification are important in the next steps, actually, just to maintain the hazard as a plan.
Yes. So there should be a validated methods that can be presented to the governments or the municipalities, where we can prove it to them that what the process we have, the plan we have is as per the laws. That makes a food safe. So anyone, others who want to discuss on this, how you're keeping your food safe?
See, to keeping your food safe, first we need to think like what ingredients we are using. Are they under the date, are off the date? Second thing is that about the hygienic. Are the place where we are cooking the food, this place is hygienic, it is approved by the local authorities. Third thing is that are the catering company or the facility management or whatsoever, it is licensed by the food authority, because food authority or a local authority have so many their rules and regulations which we have to follow. After that, they are giving us a certification. After the certification, the staff, this is most matters, what kind of staff you have. Is this staff really related to the really related to the field? Are they competent? Are they trained? Are they hygienic? And what is their medical history? Then while you are cooking the food, what is your PPEs cooks are going to be used, and the pots and the machines for the processing of the food. After, are we checking the temperature and maintaining the temperature properly? And lastly, matters how we are packing the food, and what will be the packing temperature, and on what temperature we are delivering the food to consumers. This time frame most important to keep the safe food, because if we reach the peak time frame of the cooking, then the food start become spoiling. Usually while we are cooking a food in our home, once we are keeping in the container for some safety, we just keep left over the containers cover to remove the steam, then after we can cover. But in UAE or a Gulf scenario, while we are distributing the food, we don't have this much time. So we need to follow all the time frames and the intervals from cooking to delivering the consumers. So that's, I think, from my side, how we need to keep the safe food, or we can make the food safe.
So basically here the HACCP mainly concerns like how we are keeping our process on a systematic approach. So once you have a team, a plan, and how the all levels of the systems or the people, how it is followed. So here it is like the team will, it is a total a teamwork. So it's called as a food safety management system as well. So this is how it works with a HACCP as well. So next, here what we considered as the path or categories which we will be considering on the HACCP when we are planning our HACCP. So here it is like free from the microbial or the biological, what we call the pathogens, how we are safeguarding it, are safeguarding our food, or from the physical contaminants, like one of our here the member just told, like metal contaminants, how it will be done with a tracer, metal tracer that will be detecting on an each and every hour basis. So that might be physical contaminants. And chemical, here the chemicals might be some sorbates or the KMS, like in the productions which the manufacturing units will be using. Like there will be a certain limits as for SO2s in the manufacturing of pickles or the gherkin industry we have. So there will be few limits to it which should not exceed, or else it might be a health hazard as well, the chemicals. So that will be assuring on a HACCP team that all these points are covered, and making sure like if it is on temperature after like pickling, processing of the food, how the temperature is controlled. So next, what is the safe food? How it is obtained? So when we have categorized ourselves, like what are the pathogens or what are the microbial or the chemical or physical contaminants, then how we are doing it and how we will be correcting our processes. It's by like correcting and carefully we are managing all these points and protecting the food from further contaminations, or if you sometimes might be will be doing it on these some foreign materials or foreign contaminants which might not be, like if we are having an overhead tank, how we are protecting it from the other contaminants from the air. So all these processes we should be considering while making a HACCP process or a HACCP plan. So basically, HACCP is a management system in which food safety is addressed through the analysis and control of all the hazards like biological, chemical, physical hazards from raw materials, if it is a production, manufacturing units, and from where we are taking from our vendors and how it is handled. So once we receive it, like one of our member here just told how they will be doing it, like how the storage conditions, there might be 3 or 4 categories. If it is a dairy, you have to maintain the milk at a particular temperature until it is processed, or if it is in the process, the temperature is the major concern. So that will be during the manufacturing and distribution and consumption. So it is a process of farm to fork, how from the farm when it is procured and how the consumers are, how we are giving our final product. So basically a farm to fork process, or it might be a restaurant where the food is served. So next, the hazard analysis is also defined as the process of collecting and interpreting the informations on the hazards and conditions leading to their process and their presence to decide which are the significant food safeties and how it should be done. Like how I told, like the HACCP plan. So here you can just see this flow chart wherein the hazard is how we identify the hazard for a chicken manufacturing or the frozen, and how it is controlled. It is controlled by the temperature, and how it is done, the recording, how we call as document controls. They record, they monitor, and if it is not recorded, when there is no plan, so that the temperature variations might lead to the hazard and spoiling in the chicken, which we cannot use it. So these records are controlled. When it is controlled and when it is not controlled, how we take the corrective actions, how it is done. So and the verification. So this all is a series of process which involves a HACCP team. So next, coming to this history of HACCP or how it was initially done. So this was done basically with a Pillsbury when the food had to be sent to NASA. And here is a history how it has generated, like from the Pillsbury when the food had to be sent, and it started slowly. After that, it was given a name, and in the year 1971, after the success of the Pillsbury finding and with the National Conference's protections, the Food Drug Authority, which is the FDA, proposed their idea to establish a critical hazard testing and training program on the canned foods, because the food how we have it here, it cannot be directly sent to the space. So these were the basic initial things at the time when the hazard all started. So next in 72, the 11-day training program and the evaluations wherein the FDA inspectors started on it, and it was named after that it's HACCP. After the trainings, so the food regulations they started, or they first published it in 1973. Next, the use of HACCP programs spread throughout the food industry in USA and Europe, where it initially started and later it is globalized. So HACCP was introduced to the European Union, where they officially make the plan and legal requirements. All the EU, which is the European nations, are implementing the HACCP laws. So HACCP now also it is into the FSMS or ISO 22000 who are into the manufacturing sector. They'll be clubbing it HACCP or the ISO 22000 for the FSMS, where the similar things are there. So in 93, the National Advisory Committee on Microbial Criteria for Food Safety revised the guidelines and adding 5 preliminary steps and 7 current principles in HACCP in 93. But as of now, there are the 7 principles and 12 steps which are followed in a HACCP. When you are making a HACCP plan, so you will be knowing it in depth. So next, in 98, the requirements for all the food businesses to obtain a food safety and certification under the guidance of the HACCP, so which is you basically done with the FDA approval. Next, first windows of a HACCP or the HACCP solutions that sold online or to a small customers. Next, need of food safety management system. So why now it is a major important thing to have a HACCP system into your sectors like manufacturing or a catering services. Everywhere the HACCP is there. Why is it majorly concerned now? Because in earlier stages, like in 1900s, it was not an important thing, but now as we are moving ahead, so these are considered as a major thing. If you have to start a manufacturing unit, you have to have some basic, like from the municipalities or the government authorities approval, as well as you have to have some certifications on this, how you will be working. So when do you need this FSMS or the food safety management systems, and how you will be protecting your sections with these hazards? So next will be like foodborne diseases. Now, as we all know, in these situations, how the COVID has affected our all day-to-day activities. So we are concerned with our health, family health, and our business as well. So here we will be concerned on the foodborne diseases that are widespread and which will be an issue to the public health as well. So that might be with the Legionella, which is considered as a major concern in the meat or any food manufacturing unit, how we will be controlling and the spread. And recently we have seen many of the orders from few of industries which will withdraw when knowing its presence for Shigella or the Legionellas. So biological hazard is a major concern for the manufacturing sector. And here emergence of foodborne diseases. So might be into a bakery industry where the production or the shelf life is given on a very short notice, and how the FIFO is maintained. So that's the first in, the first out. So based on the manufacturing date and the expiry, and how it is given as best before or used by when it is labeled. And next is the increased knowledge and awareness of the serious of the health issues when it is concerned. And as per we are moving ahead, we have the new technologies of packaging, temperature control, vacuuming, and all these processes, how it help us in protecting our food and giving it a longer shelf life, and increased awareness of the economic consequences of foodborne diseases. So this will be few of the things. And when it is in increase the number of the vulnerable people, or here it's just telling how if we are not controlling on the hazard, how this will be affecting. Next, the mass production when we are doing, how it will affect when you have to control all the critical points, when we need to we have a more incoming on the goods, and we have to process it and complete our process, how the things we have to maintain the hazard systems in, we are having more workload or the manufacturing. So that's how we will be maintaining it. And in and how will be conveying it to our consumer, how we are doing it on the safety. Next, coming to the HACCP concept. One second, let me see on the chat box. There are any questions? We'll just get back to you. I just have some questions. I'll just check on it, and one second. Just give me a moment. So a participant is just asking what's the difference between the shelf life and the expiry date. I'll just be coming on this topic after the session on the discussion part. Thank you. So next, coming to the HACCP concept. So assuring food safety, how will be assuring? So how it is like farm to fork or farm to table when we consider it as a restaurant, or catering services when the food is delivered, and in the manufacturing when a product is manufactured, and how our consumers are having it at the end point. So here we'll be emphasizing from end product testing to preventive control of the critical aspects of producing the safe food, which it tells like we are having all the steps to control the hazards, and identifying the potential safety of the problems, and determining how and where these can be controlled or prevented, like how we have a control on the hazards, and how if it is a temperature control, how it is monitored, or if it is from other hazards which will be doing, how we are controlling it, and the documented everything should be documented, wherein we can verify it after the process as well, and describing what to do, and how we are how we are training the personnel down the line. So there will be supervisors, and on the line there will be people who will be doing the food handlers and the food safety people, the food handlers, and the, if it is a restaurant, how the chefs are cooking, how the cleaners or the people who are cleaning the vessels, how they are doing it. If the chemical hazard might be from our detergents or the dish soap, washing liquids, so how or what categories we are using it, just randomly we cannot use anything. So that might also affect, and what water we are using. And so all these things should be monitored and should be tested on intervals. And here the implementation and the records, what I told you earlier as well. So it's important to always remember that establishment of effective hazard program involves primarily the application of good common sense and preventive considerations to address situations before they become the problem. So we will be having a plan and a team who will be monitoring it and recording it on a timely basis. So the emphasis is on the prediction rather than the reaction, on getting the process right initially rather than correcting it after the problems have occurred. So we will have to have a hazard plan before any manufacturing goes into effect. So that's how the hazard will be working. This is how it works, like when a raw material is processed, how it's during the process, the packing, the shipment, and how the hygiene officer will be controlling, or how he will be managing the documentations, and during the process as well, how it is done. So here a few examples who will be responsible for the hazard team, or what it is called as a hazard plan, where the government or the municipalities, they will be responsible, or the legal requirements what they adhere, and as well as during the manufacturing from where we are procuring. If it is a manufacturing raw, it comes to the farmers, and the manufacturing as well, which where the main process will be done, and the final product where it is delivered to the consumers. So these are the major objectives of a SAP, where how we will be doing it, wherein the quality systems comes into effect, from where we'll be avoiding or preventing of foodborne illness, that is a biological hazard, reduction in loss due to product recall. That's what we call it as fuel, like with the Legionella effect. The company will be withdrawing it after the shipment reaches to the other countries. The whole process will occur into the loss of the company. And protection and reputations, that's what, when a product is recalled, it comes into the news, and it affects, like for the Maggie company as well, wherein we can see for the metal contaminants how it affected the company. And later, after the verification process, they again got the proof certifications as well, that there is no effect on the people because of the more contaminants on the metals. And as well as reduction in the cost, or during the food analysis, we can see if there is more, we can for example, if we are considering a manufacturing sector where there is more in the garbage, the company is not having a food plan, wherein we have to see the recycling or the loss, or during the production as well, we have to maintain the system so that it has a loss into that, which is not affecting more on the production as well. If we are taking some manufacturing, consider if it is a gherkin or some pickling of gherkin, wherein you'll be getting in tons, and you don't know, you don't have a plan how to process it. You can, how, if you are not having a cold storage, you can process it on the next day, then all that thing. If it is more than 5 tons, you cannot process everything on a single day. If you are not capable enough, then the raw materials is a waste, so that leads into the loss of the company finally when you're calculating. So that too we have to count, that will be on the cost part. So here basically we will be requiring, who will need a hazard system or hazard plan into this. units or the manufacturers or who else will be requiring a HACCP system. So HACCP is applicable at all stages of production of one item. So might be your food manufacturing sectors or any other manufacturings or into the engineering as well, wherein you have to control the hazard as into your which you have to have a control points on the hazards. So all who came into contact with the product at the stage of the treatment, processing, or the distributions applying to the principle of HACCPs. And the industries which are required to have a HACCPs are production, processing, packaging, storage, transportation, and distributions as well. Yeah, coming to distribution, you actually need, because once the product is packed, how it is delivered to the customer might be in the containers, or you have to do the fumigations, you have to have the humidity in the control, you should not have any water content in the container. That might affect in the microbial contamination, because the process will be, if it is going from India or to the European, it will take a couple of months through shipments, and the container should be fumigated so that there is no microbial contaminations. So that is as well. And the preparation and distributions of food, like in the catering industries, and the food which is supplied to the hospitals, hotels, and how it is done in the restaurants and the caterings in the airlines and other companies. So other shop retailers and the catering services who will be requiring who will require a HACCP system or a HACCP plan into consideration into their units. So here, this is how the Codex Alimentarius has implemented into the system. So this is an European standard, which is called as a Codex Element Implementations or Codex Alimentarius, from where it has started, where the 12 principle or 12 steps of the hazard have started, wherein we all have to have a hazard plan, what I was talking about. So here, how the hazard basically works and how we are this like categorizing, like where should we have to have a critical point and how it should be maintained. So how the name itself tells it as hazard analysis and critical control point. So each steps will be explained now. So here how the hazard team or a hazard plan works. So first we should have a hazard team, wherein all the people in the team might be a 10-member team or a 12 members team or a 7-member team, depending on the size of the manufacturing unit. You can make your HACCP team, and you have to define their terms, references, scope of the study, and how the HACCP system works, and how you will be defining your HACCP from your, wherein you will be defining your contaminants or how you will be controlling. So next, describing the product or the process or the recipe. So here comes a HACCP plan, where if you are taking a gherkin or when it is manufacturing, so what is the product? So the final product will be a mix of chili, herbs into an acidified food of vinegar, which is done in a media of acetic acid or vinegar. So you have to define all the recipe, like when you are going to cook, how the chef define the ingredients and what is the procedure. So the same way you have to define the product, what you are going to manufacture. So this is the thing, what it comes defining or describing your product, and identify the intended use of each thing, how it is done. So if you are taking the media into the gherkins, that is used in each and every product, or the seasonings if you are using, or if you when you are cooking, the seasoning, how often you are using each thing. So that should be defined as in the intended use. And you have to have a flow diagram of each thing. So one manufacturing unit might have 20 to 30 products which they are doing. So each product should be listed and categorized in a flow diagram, from who is the hazard team, what is it intended use, how, where in the critical points are described, what is your plan, corrective actions, preventive actions, if any hazard has occurred, how you should have a plan, how you'll be controlling it, and how you'll be After defining the process, you have to validate the same thing. How you will be validating? You can do a protocol wherein anything, if your sector has gone through the hazard, might be a person or a worker has fallen ill while during from the manufacturing thing or from the line of manufacturing, if he has got any he owned, and if it is not seen and that goes into the product, if the handler is using without gloves, how you are validating? You can do it by the plans, or if it is anything happening, you have to have a plan which you have to validate it after it is into the line. So next, identifying the hazards, risk, and severity. So there is, after defining the flow chart, you will have a checkerboard on it, wherein you will be giving the risk from the hazards which is causing. So each risk, you will just see what is its severity. So it can be from 1 to 4 and 1 to 4 on rows and columns, wherein you will be defining your biological hazard, chemical hazards, and everything, and how you are measuring. If it is the measure 1 into 1, you will get 1, then it is manageable, it is not a hazard. So in each different process, you will have your own hazard limit. When it is exceeding 5, so this is called as an hazard, or when it is crossing 6, you have to have a critical point or the critical measures how you will be doing. So that is called like identifying the hazards. When you slowly start doing or are working on a hazard team, you will have more idea on this. Next, once you have the checkerboard, you have got an idea like which hazard will be more um, affecting your product or the process. Then you have to have the critical control points, like the temperature control, or when the manufacturing of pickling, and the temperature as well, and how you are maintaining that temperature. As per the data, we have to do it as per the scientific data. It should be like 72 degrees for 3 minutes. So then your product is safe, or the 15 minutes what it is actually done for 75 degrees. So how it is done, when we are putting the tracer into each and every process for 1 hour, so all that processor or the temperature control, it catches the temperature, the data logger what we call it as, and you can have a track on it. If your product is going up and down, then with the tracker on each batch, you can just have a note if the product is safe. So that will be a scientific data which you will be safe, which you will be preserving it as a control of your food, that it is safe. So that will be a data logger which will be called as the control point you are keeping in your system, that you will be doing it. And the control points using a decision tree, that's the principle 2 of the HACCP. Like how I told, there are basic 7 principles and 12 steps which each will be doing, wherein the first will be the hazard identification, and second will be controlling those hazards and keeping the control points, and next will be establishing the critical limits for each critical control points. Like how the temperature is a critical, what you have found out, it is a critical point that is affecting your product. If the system, if we have not maintained our pasteurizing unit for maintaining it 75 degrees for 15 minutes, so that is our control point. And next, how we are doing these critical control points or maintaining these critical control points. So setting up our system so that each and every product or the jar which passes through the pasteurization unit is maintained for 15 minutes at 75 degrees. So we will be keeping it as 95 for 1 hour, wherein first will be the cooling, then the heating, wherein the temperature reaches, and if it is exceeding, that won't be a more problem. But if it is not maintained, you might have a biological hazard which can lead your whole lot into waste, and that will be a loss to the company. So that will be establishing the critical limits for each. Might be 2-3 critical. Basically, majorly the companies, they have one or two, might be in the packaging if it is, or in the manufacturing bottling as well, though temperature. So that will be the major critical points. And here we'll be establishing the monitoring system that is called a CCP, critical control point, which is the fourth principle. Next, after keeping the principle control point, and it is monitored, and if any, like I told you, if the temperature is not maintained, how you will be doing the corrective actions. So here we should have a corrective action in plan that can control. The CCP is out of control when you are, if any, during the manufacturing, some technical issues might occur. So you should have a corrective action as well. When, how you will be controlling, when there is a control point set up. So once the lot is finished, you will read the data logger. If anywhere the temperature is not controlled for 75 degrees 15 minutes, so how the action will be taken. Next, the verification of the procedure. So all this as a plan is done, the product is manufactured, and the procedures, how you are doing, everything should be a documented process. Next will be the documentation and record keeping. As per the authorities, we have to have for 2+1, 3+1, depending on the product, what you are doing, or it might be 1+1 years, wherein you have to keep your documents under control for this time, so that anytime any product, like we are defining the shelf life as 3 years for few products, so you should have +1 year in your company of the batch, so that if tomorrow, if some customers are complaining, so you can do the shelf life studies on it, and the company as well have the recall plans, or it might be the manufacturing online, the QC documents, which should be maintained for this certain period of time, that is called the documentation and record keeping of the process. So next, how this is done, how your HACCP team is formed. So these are the processes. Next, how we'll be doing it on. So here the management system or the management commitments are the systems from the FSMS part, which are majorly which should be concentrated to, like the continual improvement, where we'll be keeping the control points and how day to day we will be checking on it, or we'll have a process called like the management procedure or MRMs, wherein the internal audits or the management reviews, where we'll be knowing how we can improve further on these points, or the continual improvement, which it is called as, and the food safety policies. And what is the company policy we are keeping to control or to declare that our food is safe, and the organization charts and the JDs of the each person under the process, like from the supervisor level and to the person who is in line on the packaging and delivering. So all the person in charge should have the JDs described in the HACCP, and how your documents are controlled. Like I told you, 3+1 year, what is the document you have to have for a longer period, or plus shelf lifetime, what you have to keep your quality documents under control. And the documents, what are, like you have master list of documents, like your company, what are the documents with regard to the HACCP or the quality, what you will be having, and how it is maintained. It should be countersigned, supervised by, or done by. Everything should be a documented process. So these are the systems, we call it in the management system processes, which are similar to FSMS or ISO 22000 process. So this is the thing into the HACCP, what are the things, how a HACCP works. So anyone having any questions, you can post it on the chat box. I'll just look and answer to it. So just someone from here just asked me a question, which I'll be answering it now. So what is the difference between the shelf life and the expiry date? So this is a major doubt between the people, like what will be the shelf life or the expiry date. So here shelf life is coming to the product on a bakery product. Shelf life is wherein the product is safe for 3 days. When you see the 3 days it is safe, but having it on the 4th day is not a problem. It is safe, but they just declare it might be some contaminants or the microbial growth. You can just see it for the yeast and mold. So that is called what they declare it for the shelf life. And expiry date is for a product more than 1 year, what they will be declaring it as for the expiry date. So that will be a difference. So any other question? One second.
Ma'am, excuse me, ma'am.
Yes.
Ma'am, what is the difference between HACCP level 3 catering and like a regular HACCP level 3? Major difference
Can you come again?
Ma'am, what is the major difference of HACCP level 3 for catering and HACCP level 3 for like regular?
On the certifications you are asking about?
Yeah, ma'am. Yeah.
I'll just get back to you on this, or our team will be getting you back on your question. Just give me a moment.
Okay. Thank you.
Yeah, now like ISO 22000 is more, you have to have a 22,000 certifications for a manufacturing unit. That is a question, like when we talk about on the second point of HACCP, describe the product and the procedure, construction. No, the product description and the flow diagram are not the same. Just got this. Like here, defining the product will be your product, how it is manufactured. Both are not same. So the difference between the PRPs and OPRPs are prerequisite programs what you will be having already into the process, and the OPRPs are the operational prerequisite program. When a breakdown or a failure happens in a system, how you will be handling it, and the documents how you are maintaining it. So these are nothing but the processes similar, but there are into the operational processes, what are the requisite programs you have to have. The HACCP documents should be maintained based, like I told you, the manufacturing sector, you have an expiry of 2 years or 3 years. If it is 2 year plus 1 year, will be a mandatory thing what you have to keep your documents.
Yeah.
So any other questions anyone is having on this
session? Yes, good afternoon, Shima.
Yeah, good afternoon.
Yeah, this is Junard. I would like to ask regarding the cooked food transportation vehicle. Is there any Dubai Municipality requirement for that to transport cooked food, and what is the specific transportation vehicle for that?
I'm not sure on this with the Dubai Municipality part. I'll just will consider your point. Our team will get back to you on this.
Thank you.
Hi, Shama. Can I give an answer on behalf of you, please, if you don't mind?
Yeah, sure.
Okay. See, Mr. Junaid, for the
Yeah.
Dubai Municipality, there is a specified approved vehicles for the food transportation. That transportation must not be used for any other purpose except for the food. So while we are transporting food, either it is prepared from the catering company or any kitchen or whatsoever, a specialized team will be packed, and they will be packed into the hot containers. Approximately temperature will be 63.5 to 66 point something like that, if I'm not wrong. And then the driver and the helper all must have hygiene certification with some kind of a medical certification. After that, any other food handlers, they must also undergone for the medical with the certification. And this food vehicle will be having one checklist on a daily basis, which will be filled by hygienic officer or a safety officer or a driver itself or a food controller head. Then this food vehicle will be under controlled temperature. So there will be a certain and specific requirements for the food transportation.
Thank you, Mr. Wakas. But we have that approved vehicle. It's a cold storage. So that approved vehicle is used for buying vegetables and fish. So how about the cooked food? We can use the same vehicle for the cooked food because it's a hot.
This vehicle can be used for a multi-purpose. First thing is that you are buying a raw material and you are bringing in that. But
Yes.
the raw material, you cannot having a specific requirements. But once the food is cooked, it must be contained into the hot containers to maintain the temperature. That's what I said. This food vehicle must have one checklist, which will be fulfilled by the hygienic or a safety or a food handler, some supervisor or a head. And this cooked food, you mean the hot, we need to maintain the temperature. So it should be into the containers, and this temperature as well as maintained by the vehicle inside itself.
So we can use the same vehicle, Mr. Wakas, only we can put in the hot container.
Yes, you can use that one, but it should be hygienic.
Hygienic,
It
yeah.
should be hygienic, and
Yeah.
with all these handler certifications, medical certification, and the checklist on a daily basis. So
Yes,
in
yes.
case you have inspection, they will ask first thing, who is the competent person, where is the checklist, what is the temperature, how you are transporting. If you remember in the earlier startage of this course, I speak about the process of the food. The same thing you are asking now. It is a similar to.
Thank you, Mr. Wakas.
So one of our members is asking the difference between the control points and the critical control points. So I just want to explain you, like, control points are the points where you are keeping the from your start level to the end level, you will be keeping as a control measures, like might be the PPEs are the control measures while manufacturing, all the personnel should have, and the temperature check, everything should be under control. So CCP are the points like critical control points that will lead to the hazard. So that is the measure, that is the major difference from the critical point and the critical point and control points and the critical control points. I hope you got the point. Wherein the hazard is caused, it's majorly controlled and documented is a critical control point. Any one of you having any other discussions or questions on this?
Assalamu alaikum.
Walaikum salam.
I want to explain critical control point. One more difference between control point and critical control point.
Okay.
According to my understanding, critical control points are those points. If we do not control the hazard, it cannot be controlled in further process or further step. So it is very necessary to control our hazard at CCP. If hazard pass from that point, we cannot control in any other step.
Yeah, that's what we are establishing the limit, critical control points, wherein you have to have that control which should be monitored on interval basis. So that will be a critical control point that will lead to a hazard if it is not controlled. The same thing. Thank you. And one of our is asking if pasteurization comes under HACCP. So based on your manufacturing, if you are keeping it, pasteurization is not a HACCP, or it is a process where we are doing it, like for milk production, and how it is processed at what temperature. So the temperature is wherein we will keep it as a CCP, but defining on your processes, you have to define it. Depends on the unit or the manufacturing sector, which the team will be deciding what you are keeping as a CCP. Thank you. I want to request you, if it is done, just open your camera so that our team will have.
Yeah, adding to this point, pasteurization, just most of the industries, because pasteurization is controlling of microorganism, so that most of the industries like beverage industries, it is a critical control point.
Yeah. Request everyone to just on your cameras for some time so that we'll have a.
First of all, I thanks to everyone to joining this session. I do believe you guys has enjoyed the session. So now we are going to close this session, and I have shared the feedback form on the chat box. It will be more appreciated. You can share your comments on that to improve our quality of services. So TMC is one of the approved company in Dubai Municipality who's providing the all trainings like HACCP and many more. You can for the more information, you can follow us in our Instagram page, in a LinkedIn, and our upcoming webinar will be going to be scheduled on coming Saturday. It will be related to a dietitian part, how to do the calories checking and many more. So if you're really interested, if you really wanted to know about the calories part, you can just follow us in our Instagram, Facebook, and as well as LinkedIn. Thank you so much for joining us. And thanks for your valuable time. You can just share your comments and you can just share your feedback form as soon as possible, and we will be sharing you the certificate accordingly.
Thank you, everyone.
Thank you.
Hi, thank you. Can we switch off our cameras?
Yes, of course.
Thank you.
Thank you.
For this training session certificate, you can just fill your feedback forms and our team will guide you on this.
Sure, thank you. And when
Okay,
can we
thank you
leave
very
the
much. Thank you.
leave it now?
Yeah, you can just leave. The
All right, thank
session
you.
is done.
Thank you so much.
Yeah.
Where the feedback link, ma'am?
The link is posted in the chat box. You can just
It's
check.
not showing. Can you send again?
Yeah, I will just share it to you again. Munaf, can you just post that message?
Yes, Ms. Shima.